direction, basically. So, starting with your aortic arch, which branches off of your heart to the left. Almost always does the aortic arch branch off to the left. In these three, we see how the aortic arch branches off to the left. See how it comes this way? I'd say that's the case in 99% of rats. Okay, so off of your aortic arch, you have the right common carotid arteries and the left common carotid artery. This is your right common carotid artery, and that's your left. If you notice, your right comes and fuses with the left or right subclavian. So that little point where they're fused together is called your brachiocephalic trunk. So it's brachiocephalic trunk and then right common carotid and right subclavian. Whereas on this side you have left common carotid and left subclavian as two separate parts. Okay. Then you follow your left subclavian or your right subclavian up, right subclavian up, and start looking for things that branch off of it. So, judging by the name of the artery, you can start identifying some of the arteries that we see here. Like this one. It follows the internal part of your thoracic cavity, so it makes sense that that would be called your internal thoracic artery. Right there. Now, if you're looking for an artery that's your costocervical, it's going to be going back to your cervical vertebrae. So it's going to be the one that's branching down right there. See that little tiny thing? Can you guys all see that one? So that's your that's your costocervical. The one that's coming back and going straight into the neck right here, going to your vertebrae, is your vertebral artery. Right there. We follow this up again, and we'll see that at some point it kind of branches again, like right there. And we see how it branches into two parts. This is your superficial cervical artery going up right here, and then coming across right here is your auxiliary artery. It runs right over the top of that bone that's broken. And then we have the body wall, and you should be able to see, okay, so see how there's a little pink thing that comes out right there? Mm-hmm. That's your lateral thoracic artery. And when it comes, you can follow it even further out to the arm right there. It's actually two separate branches, but that one right there is your brachial artery because it's going to your arm.
Where's the other one you just pointed out?
The lateral thoracic? That is right there.